applies. I'm coming in, I wash my hands, I introduce myself. Hi, I'm Rebecca, I'll be your nurse today. I go ahead and ID them. Can I have your name and date of birth? Walter, 1/1 of 20. Wonderful, I verify that. Then I go ahead and provide privacy, and then I explain, I'm going to be taking a listen to your heart, checking your pulses, just taking a look at your skin, and then I go ahead and he's in a good position, so I don't need to make any adjustments. All right, so I would, for inspection, so the big thing to know is the location of the heart. So it's located between the second intercostal space and the fifth intercostal space, with the apex being at the fifth and the bases being at the two intercostal spaces. All right, then I will go ahead and palpate the apical pulse. So I will go ahead down to the fifth intercostal space, so 1, 2, 3, 4, 5, at the midclavicular line, and this is where I would palpate the apical pulse. All right, now Walter, I'm gonna go ahead and take a listen to your heart. So with my pretend stethoscope, I will go ahead and take a listen. So I will come to the right sternal border, second intercostal space, and auscultate the aortic heart sounds. Then I will come over to the left, sternal border, left intercostal, left second intercostal space, hear pulmonic valve sounds. I'll come down again along the left sternal border, third intercostal space, Erb's point, and then I'll come down fourth intercostal space, left sternal border, to hear the tricuspid valve sounds. And then lastly, at the fifth intercostal space, midclavicular, I would listen to the mitral valve sounds. All right, and then I will go ahead and take a listen to the S1 and S2. The S1 indicates systole, so that's when the ventricles squeeze. During S1, what that sound indicates is a closure of the mitral and tricuspid valves. S2 is diastole, and during that time, the S2 sounds indicate that the pulmonic and aortic valves are closed. All right, Walter, now I'm gonna go ahead and palpate your pulses. So I'm going to feel your temporal. Then I'll have you turn your head to the side, away from me please, thank you. So I'll feel along for the sternocleidomastoid muscle, the medial aspect, upper third. I'll only palpate one carotid at a time. I'll go ahead and do that. Then I'll come down and do the brachial. Then I'll come down and do the radial. All right, and then I'm going to check for your lower extremities. So I'm going to feel femoral. You can either do both sides. Then the back of the knee, the popliteal. Then at the feet, I would be feeling the dorsalis pedis. And then the posterior tibial. And all pulses and locations are palpable. They're +2. They're not bounding. And then I would check also for when I palpated, I checked and there was no edema. Capillary refill in the hands are less than 3 seconds. Similarly, in the feet, they are less than 3 seconds. And then as I felt with the back of my hands, bilateral upper extremities are of equal temperature. Lower extremities are also similarly equal temperature and warm. Okay, and then I'll move next to the 5 Ps. So I already was able to palpate the pulses, they were all normal. I'm able to see that the patient is perfusing well, they're not pallid, so there's no cyanosis. Sensation, so I'd also ask if they're able to feel that I'm touching. Sensation is intact. Do you have any complaints of numbness or tingling? does not have any complaints, and any issues with movement, any paralysis. There is none. So that is all. All right, Walter, that's all I'm going to do today. Thank you so much for letting me just check on you, make sure you're doing okay. So I'll go ahead and get you more comfortable, get you back in a comfortable position. Here's your call light. I'll be back in an hour. If you need me before then, go ahead and put that light on. I'll go ahead and wipe the stethoscope down, wash my hands, and then document.